I'm here with Professor Marilyn Bui. She is a senior member and professor of pathology at Moffitt Cancer Center. Hi, welcome.
Hi.
Thanks for talking with us today. I think our big question for you is, how can we ensure that these scientific breakthroughs are really translating into meaningful benefits for patients?
There are a lot of scientific breakthroughs, which is great news. However, the real clinical adoption is another issue. So there's a big task right in front of us, all medical community, is to connect the targeted therapy, making it into the clinic so patients can benefit from it. But the revolution right now is digital pathology and AI. We're hoping to augment pathologists' ability to identify biomarkers more accurately, to diagnose the disease more accurately and more effectively, so we can really help with the patient care.
How are you finding that that's sort of changing your clinical practice and also training?
The way I look at it, AI can really do the following things, help us to find the cancer, classify the cancer, and also quantify the biomarkers and also provide prognosis and predictive information.
What advances that you're seeing give you the most optimism?
I want to emphasize the biggest improvement is actually to augment the way for biomarker testing. So traditionally, we just eyeballing it and then give a percentage and then just call it positive or negative, but it's no longer working. For example, as breast cancer, that's the #1 cancer for women in the world, used to be just HER2 positive, HER2 negative, and then you treat the patient with HER2 positive. However, the spectrum of HER2 is evolving. So HER2 low and ultra low that used to be in the HER2 negative group, that there's no target therapy, but now there is an antibody drug conjugate that works very well to provide hope for this group of patients. With AI, our ability of accurate and efficient diagnosis will really be improved.
Obviously, if we're going to see health systems really embrace these new changes in order to start to see those benefits for patients, what do you think needs to change, for that sort of global adoption?
So there are multiple barriers for that kind of adoption. We have regulatory barriers, and the reimbursement barriers, and also technology. But there are certain things we can do right now is to educate pathologists, to expand our expertise, learning these biomarker testing, molecular genomic pathology, and the digital pathology and AI to really sharpen our tools and expand our expertise.
Professor Bui, thank you so much for talking to us today.
Thank you.